you have to be a certain kind of evil, like a certain kind of something, to be able to look one of your patients directly in the face as they are potentially dying and coughing up blood, and have the look of like not a care in the world. I don't know. But then when he came in and was like, so she's gonna be discharged, and the guy that took over from my care, I'm burning up. The guy that took over from my care was like, no, I'm gonna keep her because XYZ. And this man was trying his best to just like get me out of the hospital. And even though I just had this CT scan that showed a massive amount of fluid.
My name is Stacia Jeanette. I am 29 years old and I am from Knoxville, Tennessee. I am every day physically struggling. My body, my joints are always hurting. My muscles are always hurting. I'm always fatigued. I don't get rest and I feel like I'm mentally exhausted. My first health issue occurred when I was 14, about to be 15. I was getting ready for a track meet and about to run my race. So I was doing some stretches and I just passed out. And when I woke up from passing out, it was like the life was taken from me and literally nothing was the same after that. It just like my health just plummeted. There's a lot of speculation as of what is the primary source of my health problems. And I think that is a large contribution to why it has been now, almost 16 years and I'm still struggling. No one can agree on one thing. A lot of people keep pointing the fingers at the Crohn's disease, saying because my Crohn's is not very well managed or under control, that it is causing essentially everything else to be out of whack and cause me to have other additional health problems, symptoms, occurrences.
Okay, guys, I'm at the hospital ER again on my birthday. My port is accessed. I've been having constant diarrhea and a really bad abdominal pain, nausea, throwing up. And these are the same symptoms that I had back in May that got me admitted to the hospital with C. diff. And I think that's what I have this time as well. It's green and just awful. So happy birthday to me.
Were you to manage your Crohn's disease in a more, in a way that they consider to be more in line with how it should be managed? Have you attempted to try any of that?
It shouldn't be this difficult, I don't think, to come up with a plan of action, a more effective means of trying to get my Crohn's under control. And I have asked, can we try this or could we try that? And I think there's only so far that you can advocate for yourself and say, this is not working. Can we try something else? Can we try this? Because on the other side of that, you have to have other willing participants, other willing healthcare providers who are up for the challenge to think outside the box. And that there's not many that I have come across thus far.
So for the people who may not completely understand, can you describe how Crohn's disease normally looks?
Yes. So Crohn's disease, it is something that what most people don't know is Crohn's can affect you from head to toe. So it is an autoimmune disease that essentially causes your immune system to attack healthy cells, tissues. things inside your body that, are normally fine. It can affect literally your eyesight. You can get an eye inflammation, cause you to have visual impairment. You can have skin breakouts. There's a thing called Crohn's rash. So you can get literally skin gets affected. You can get mouth ulcers. But the main thing that happens with Crohn's disease is it affects your large bowel. You get a lot of fluctuations between having constipation, having really bad diarrhea, vomiting, nausea, bloating. It's a really rough and uncomfortable disease to deal with.
Day 2, low blood pressure and high heart rate. 102 beats per minute right now. Laying down.
You mentioned that your colon has been removed. Was that done prior to or after your Crohn's diagnosis? And what is the normal procedure in that? Is that how it's normally done?
So I had my colon removed after my diagnosis of Crohn's disease. Sometime it was back in, it was right before 2015. It was in April of 2015. And I had it done because I had slow transit motility. That is the pure reason why they took my colon out. However, when you have Crohn's disease, there are things that you can have a resection done if there is a localized area of the intestines, be it small or large, that has Crohn's in it. They can go in and do what's called a resection, where they will cut out the section that is severely affected by the Crohn's disease and then reattach the healthy parts. That is what normally happens in Crohn's disease, severe Crohn's, that is not being resolved or managed well with medication. That is the norm. So my situation did not go that way because there was speculation, I think, between whether or not I did in fact have Crohn's. But again, when I got diagnosed when I was 14 with Crohn's disease, they did the necessary biopsies. They did a colonoscopy, which is standard to get the diagnosis. You have to have a colonoscopy and then an EGD, which they put the camera down your throat to look to see if you have ulcers or anything in your esophagus or in your stomach. And then the colonoscopy. So they did both, and I had Crohn's ulcerations, top and bottom. So they then biopsied from the EGD and from the colonoscopy, sent it off, came back, you have Crohn's disease.
So let's say with the IBS diagnosis, were there treatments or medicines prescribed that were tried? How did that go? How did that end of it go?
So in pediatrics, because the only thing that really everyone took from pediatrics, aside from the actual biopsy result, is that I definitely had a GI situation occurring. And so essentially, instead of, me coming and saying, okay, well, I'm going to the bathroom this frequently and I'm throwing up and I'm super nauseous and I'm not able to, eat, what we do about it? It was kind of like, here's another Band-Aid for this symptom and here's a Band-Aid for this. Okay, well, here's some nausea medicine. Okay, well, so you have acid reflux. Here's some it just was never really like there was never really a solution, a resolution kind of given.
Do you feel that if you had one solid diagnosis, that maybe you wouldn't have some of the other symptoms?
I feel like if I could get everyone on one page with, number one, do I have Crohn's disease or do I not have Crohn's disease? And let's get that under control first and foremost. I definitely would probably have less of the symptoms that I'm going through and dealing with on a day-to-day basis right now, because without it, I'm constantly being dehydrated. You know, I'm constantly in pain. I'm not able to eat, right? So it just, but when you can't get all the providers on the same page to agree on a diagnosis, it makes my life, the patient's life, very incredibly difficult. Sorry. Because it is ultimately the patient's lives.
Just let it out. You're fine.
It's ultimately the patient's lives who are suffering. We are the ones who are suffering. When doctors and providers cannot get on the same page and don't listen to their patients, it's the patient's lives who are then on hold. Literally, we're just kind of at the mercy, literally at the mercy of the healthcare providers to, we put our trust in the providers to guide us and to tell us, okay, this is what's going on and this is what the options are to do. And I've not had that. The only time that I had it was in pediatrics. And I had a couple of nurses who even told me, like, you are not going to get this kind of care outside of pediatrics. And they were very true. It was very true. It is us who take the fall and the suffering in the end, because providers just don't want to get it together. And I don't even know if that's something that they think about, but literally I lost all of my 20s. I couldn't do the normal high school things. And, again, like I said, I thought I didn't even know if I was going to be able to graduate, because I was in the hospital. I was going to doctor's appointments all the time. It's a lot that this whole situation of just not being able to accurately communicate and agree on things has taken.
So now the urologist has come. They don't know what is causing the kidney pain. They're like, you didn't show anything on the CT scan, like kidney stones or anything, but yet I'm having the kidney throbbing and all that. So they're going to try to make me an appointment to see my urologist next week at the office and figure something out. He said he wants to watch me closely, so I don't know if I'm going home tonight or not. I'm in so much pain everywhere. Like it's insane. And their little 5-7 milligrams of hydrocodone every 4 hours. It's not working.
A total colectomy, and I have had 5 laparoscopic surgeries for endometriosis. I have had my left patella operated on for stabilization. I've had my right ankle operated on for stabilization. I have had my gallbladder removed recently. I had my right ovary taken out, and then ended up having to have a partial hysterectomy where they took out my left ovary and then both of my fallopian tubes. And then I had to have my port placed for my infusions for my Crohn's disease. And I had both of my hips done. It's called a bilateral hip arthroscopy because my hips were dislocating. So it just kind of helped stabilize them. And cool. Oh, and then I had bunion removal surgery on both feet. And I think that is it so far.
How has the healthcare community in general, how's your experience been with different healthcare professionals?
My experience with healthcare professionals to this date has been rocky, to say the least. Pediatrics was definitely the best healthcare that I've ever had. And literally after I got into the adult world of healthcare, it just tanked massively. Like it's called healthcare, but it seems like the care is just not there. I don't know if it's the same, for everybody else, but definitely in my situation, I'm not feeling the care, and I have not for some time. It just seems like I'm not being listened to. And I think as a healthcare provider, that's something that's really important, is you have to listen to your patients, because ultimately at the end of the day, everyone knows their body. And no amount of schooling or a PhD is going to be able to put you into someone else's body to let you feel how a patient feels on a regular basis. So if they're coming to you and saying, hey, this is hurting, this is going on with me, I think something's wrong, the inappropriate response or rebuttal to it is to be like, oh, well, I went to school for this and I don't think it's that, or to dismiss it because of somebody's age, if they're too young to have something. That's something that I get repeatedly, is you are too young to have that, specifically with endometriosis. I was in agonizing pain every single month, and my OBG would just say, you're too young to have endometriosis, so we're not going to check for it. And finally, when it got to the point where they literally had to check for it, and the diagnosis was made, they ended up doing an exploratory laparoscopic surgery. And they were like, well, there's the endo. They had the pictures of it. And then I took the pictures to my OBGYN at the time, and she was like, I don't know if that's endo. Like, again, there was tangible proof, like tangible evidence. It literally was right there. And still, it's very frustrating and tiresome all at the same time to be dismissed even when you have tangible proof.
So what seems to be the problem? I'm having chest pain and do you have anxiety? Is it anxiety? You've got anxiety, don't you? How much do you weigh? Are you overweight? If you lose like 10 pounds, are you sure you don't have anxiety? Are you depressed? Do you have depression? How many times have you thought about harming yourself? It's probably just a chronic attack, Karen. No need to worry. I know her heart monitor is going off, but what I'm telling you is that, Karen, she has a heart condition, but it's not the heart. She's got anxiety. No, don't bother the doctor with it. 190 beats per minute laying down. It's probably just normal for her. I can't breathe. You look fine to me. if you are having chest pain, it's because you're overweight. That's because you're depressed. You're thinking about harming yourself. You've got anxiety. You're just having a panic attack. Lose weight, lick your heels 5 times, run a 5K marathon, drink 9 gallons of water a day. Then you wouldn't have this problem.
It just seems like things are always being deflected onto, well, do you have anxiety? Is it your anxiety? Well, anxiety can cause this grocery list of symptoms. And it just kind of, if I may be frank, it feels as if there's this very long A to Z list of symptoms that have been put into the category of anxiety. Anytime a patient comes in with this A to Z list of symptoms. And so the doctors are immediately, literally at many different practices, specialties, not even in just one specific healthcare group. So it's not just like a GI group, or it's not just like a neurology group. Like, it is many different specialties and groups that I've gone into where they will hand you this tablet, and it is literally just a tablet about mental health. How do you feel on a day-to-day basis? On how many days have you not felt like doing your normal things? Has your mood changed? How stable do you feel on a day-to-day basis? How's your anxiety? How many times do you feel depressed? How often do you think about hurting yourself? I'm here for, you know what I'm saying? This is nothing but and then so you literally have to take this tablet and you have to fill this paperwork out whenever you go to these appointments before you can even get back to see the doctor. So already they have this informed, this already compiled thought about you based off of what this tablet or this paperwork about anxiety, depression, and your emotional state, regardless what you put on it. One time I declined to even fill the stuff out. And, their response was, why did you not fill out the questionnaire? Well, I'm not here for that, and so then an opinion was formed off of that. Like, well, it just seems like you have an attitude, like it seems like your mental state doesn't seem positive right now.
I don't know. I just don't know how people can treat people this way in the hospital, in the healthcare system. Like, how would you want to be treated? How would you want your loved ones to be treated and taken care of? Just be a decent human being. But in my 15 years of being sick, dealing with this healthcare system, the lack of care in a healthcare industry is grossly missing.
Yeah, my health journey has taken me pretty much all over the United States. Ohio is where a lot of my care is at still currently. In Tennessee, I've gone to Nashville. I've gone to Jacksonville, Florida. I have literally bounced around from state to state, trying to find just answers and solutions. I guess, like, in hindsight, I think I was trying to protect myself from being labeled like, oh, she's just like a hypochondriac, or she's just like saying things for attention, or whatever the case may be. Or just like fear of some sort of retaliation, if you will, for lack of better words, for I think essentially just voicing my opinion and concerns about my own health. So I just didn't, I just would be like, oh, okay, it doesn't seem right, but okay, and then I would just leave. But now, I'm like, enough is enough.
Okay, what is this called? Midlining?
Midline.
So I'm about to get a midline put in, and this is the process. Hopefully I won't have to deal with any more sticks and IVs coming out, and he's gonna make my life a lot better. So yay.
Now, do you find this to be more of a specific thing, more with a specific provider, or do you find that it's pretty constant across the board among all the providers that you've seen in general?
No, there's in Ohio, there's a neurology team recently that has been kind of like a glimmer of hope and like a shining light, because they have kind of reassured me that some of the stuff that I'm experiencing symptom-wise, that I have been going through symptom-wise, is not so uncommon, especially at their facility and in their field. So for the first time, I think in some years, I felt like I was not this crazy person that that they've been trying to paint me as this entire time, just for specifically saying, I know my body and something's wrong. Like, this is not normal. I should not be feeling like I'm going to pass out just taking a shower. I should not be having massive amounts of water retention just from getting a bag of IV fluid. That's not normal. Like, these are things that are not normal, but like they'll just say, oh, this is probably just normal for you. What does that mean? It's not normal. That's not normal. And the fact of it is that I've had occurrences going on with my health that have been blatantly showing something's up, and it's not that there's been a refusal to do anything. There has just been a look the other way. And that's point blank, period, is what it is. It is we see it, but we're not going to acknowledge it. And that has been across the board up until this past April with neurology.
Do you have any experiences meeting other people who are going through similar situations?
Yeah, so I communicate with a lot of people via Facebook groups for specific things. Like, for instance, I have Ehlers-Danlos syndrome, which is hypermobility, where your joints are hypermobile. Until it was a scientific term, people would just be like, oh, you're double jointed. So double jointness, is like, my elbows will bend and my knees will bend, and, like things where you can, stuff that most people, normally can't do, my joints hyperextend. So I joined a Facebook group where there's a lot of people who are in there, who also have some of the similar symptoms that I'm going through. And also, they consider Ehlers-Danlos syndrome to be a umbrella condition. And with umbrella conditions, it's basically like, okay, so here's this giant term, Ehlers-Danlos, but then underneath the umbrella of it is dysautonomia, which is something that I have. This is like your autonomic nervous system doesn't function correctly. Mm-hmm. And then also there's POTS, or positional orthostatic tachycardia syndrome, which is, you stand up, it's positional. So where if you're sitting up, your heart rate and blood pressure will either drop or rise, which can cause near syncope, or syncope, which is near fainting or fainting. That I have. Hyperthyroidism goes underneath the umbrella. Gastroparesis goes under the umbrella. Endometriosis goes under the umbrella. All these things that I was told I'm too young to have fall under it. So it was kind of like a reassuring thing, honestly, like joining some of these groups, because other people may not have the exact all the information that you need, but it's kind of like connecting puzzle pieces. Like, okay, well, I have this going on. What kind of symptoms are you dealing with on a day-to-day? What are your diagnoses? And we've all been able to kind of like put the puzzle pieces to this one really big puzzle together with each other. And I think it's very crucial for everyone to get locked in like that, because otherwise you're out here feeling like you're insane because you're not being listened to.
So what are some of the medicines that you've had to take over the years and some of the different treatments that you may have had to endure, especially considering the multiple diagnoses that you've gone through?
So, wow, out of 16 years, of course, you know, the main thing that I'm getting medication for, that I'm on medication for, is the Crohn's stuff. And again, in pediatrics, I went through all the oral medications, literally, that was on the market for Crohn's disease to get it in remission. It was like something like Azicol, Prizo, Penteza. I think there's like 3 or 4 other generics that are essentially, those are the heavy hitters. And then there's like 3 or 4 different categories of, I would say, cousins of those main ones for Crohn's disease to be in remission. I literally went through all of them and none of them worked. So then they had to segue me into the immunosuppressants, or the biologics, which are the infusions or sometimes an injection that you can give yourself. Those are Humira. I did the Humira, which was an injection you give subcutaneously in your abdomen. I did that for, I think, maybe 6 or 8 months and ended up building antibodies to it. So then switched from Humira to, I want to say it was Entyvio. Went from Humira to Entyvio, and Entyvio is an infusion. Much like, you know, people who have to take chemotherapy, you know, you have to go and get it intravenously into a vein, sit there for like 2.5 hours, let it go through your system. And then I recently, maybe 1.5 years ago, built up antibodies to it, or just stopped responding to it effectively. So then I tried another biologic that is similar to the previous, called Stelara, and I got the loading dose, and a loading dose is essentially just like an IV infusion. You get it one time. I got the loading dose, and I ended up getting C. diff from Stelara, and it almost killed me. So I just did not go back on Stelara after that. I mean, who would? You know what I'm saying? Like, and it's no shade to Stelara or anything. That's a risk when you're taking biologics or immunosuppressants. Everybody that is on it is aware of these things. You know, infections can happen. But again, it's kind of like after you touch the hot stove, you don't want to really kind of go back to touch it again. You know, it's still hot. It still has the same risk. You still might get burned when you touch it. So I just opted, nope, don't really want to go back onto that. So the options were, okay, well, let's try the generic Remicade, which Remicade was the only thing that worked when I was a teenager. So the theory here is that since it's been such a long time and it's not exactly the exact same formulation, that we could reintroduce it to see if it will get my Crohn's back under control. So it's called Inflectra, and I've been on Inflectra now, I think for, I want to say close to a year. And it works up until about 4 weeks. And then at that point I can start feeling, the stomach pain really bad with eating, I'm getting full really fast. The frequent diarrhea trips to the bathroom, not being able to stay hydrated, just the whole everything just starts being really miserable after about 4 weeks. And Inflectra is not approved to be given more than 8 weeks as a frequency. So I'm literally just spending like 4 weeks after the initial 4 weeks where it's working, being miserable. So to counteract that, they have added a self-injection that I give myself every week, and it's called methotrexate. And methotrexate is a very well-known medication. It works, but it also comes with its own very thick packet of side effects. And for somebody that really doesn't have very much energy to begin with, literally there's a thing that a lot of people who take chemo always say, they call it chemo coma. Literally, after you take methotrexate, you're drained, like for a good day, sometimes 2 days afterwards. So when you're taking this medication and you're also struggling in a Crohn's flare because it's not managed, the fatigue in a Crohn's flare is awful in itself. But then you now are adding a drug that also essentially just wipes you out for a couple of days on top of it. Literally, it's just like this very long vicious cycle that it feels like I've been trying to claw my way out of for the longest and am not able to just get ahead on anything. It's a lot.
And so you mentioned earlier that, you lost all of your 20s basically fighting different upcoming conditions that were sometimes untreated properly. How did that affect your view of yourself and your future? If you could just talk about that.
When I turned 21 and got released into the adult world of healthcare, really, I know it sounds morbid, but I really gave myself maybe like 3 to 5 years to live after that, because I was like, this is not gonna pan out well. Because I just had already seen the writing on the wall. Like, it was just simple stuff, just bare minimum that just was not even being listened to or looked into. I was just being dismissed left and right, dismissed. And so really, honestly, I didn't think I'm about to be 30, in September. I didn't think I was gonna make it this far, honestly. So, while everybody else, again, was out, enjoying college, I did a year of college and, had to stop because the fatigue literally just took over my life, because at this point, other health conditions started arising on top of my not accurately managed Crohn's. So it was just like fatigue on fatigue on fatigue. I couldn't get up to go to classes at all. So people were graduating from college and I was at hospitals or I was having a surgery. I literally couldn't do anything. I sat in my room and looked at the 4 walls day in and day out. And eventually I just took the calendar off of my door because I was like, there's no point in just looking at the days go by. Same day, same situation, different day, different year, but same situation.
What can you tell me about keeping track of records or anything like that?
Yeah, so it is like imperative if you're going to be, even when you're just beginning your diagnosis process or your health journey process, it is important to log everything, not just what medication you're taking or what medication didn't work, but how did that medication make you feel? Did you have side effects from it? Write it down. What were the side effects? What happened? Put the date, put the name of the medication. Again, how did that medication make you feel? If it didn't work for you, write that. It is very, very important. So you can always say, hey, I tried this and it absolutely did not work. Or not even just that, but even further, hey, I can't take this medicine because it literally makes me sick or it causes me to break out in hives. It's something that really you have to do for yourself, because a doctor is not going to do that for you, and neither is like a nurse or what have you. You have to do it yourself. And even a step further beyond that is, okay, so what are the things that make me feel good? Write those things down, same as you would the stuff that had adverse reactions or symptoms. And then also keep a daily health log. On this day, I woke up and these were my symptoms, or this is how I was feeling. And take that with you when you go to appointments, because it gets exhausting going to doctor to doctor to doctor to doctor, trying to explain how terrible your daily life is and what your struggles are that you're going through, and also, when you have this readily available at it saves you time and energy from having to go through the mundaneness of repeating over and over, so that you don't want to repeat. It is an enormous time saver for you in the long run, really. I just would hope that everybody can be as transparent as possible. Not just for me, but for everyone that's in this situation. Patients and healthcare providers both need to be simultaneously working with each other very transparently, not just on getting correct diagnoses for everyone, but so what's the next step? What's the treatment plan? What are the possible solutions? What are my options? It should not just be like a one-man show, and that one man being the patient. It cannot continue to be this. So really my hope is that we get there. And my goal ultimately is to be able to resume a little bit of a normal life where I'm not laying in bed, looking at the four walls 90% of the 7-day week, and it's not even like I'm resting, like I can't do a lot right now. And so I am hoping that my end goal is that I can do something at some point soon, and not be confined by my health.
There are other people, I'm sure, who may be going through similar situations. What advice or motivation would you have for them? What would you give them that may allow them the strength that you've had?
I would absolutely say, do not let anybody, not just healthcare workers, but don't let anybody manipulate you into or intimidate you into feeling like your concerns are not valid, or that you're crazy for knowing, and it is a knowing that something is wrong with your body. You know your own body, and no PhD can put you inside of somebody else's body. You don't know what somebody is going through. Only you know what you're going through, what you're feeling, what you're experiencing. Do not let healthcare providers come in and talk you down, intimidate you, gaslight you, whatever the case may be, into blocking your voice or expressing your concerns, because this is your life. And I did it. Don't do what I did for the longest. And that's hide your voice or silence your voice in the face of a healthcare provider for fear of backlash, or for fear of saying, oh, they're going to think I'm a hypochondriac, or they're going to think that I'm crazy, or what have you. Whatever. This is your life, and you ultimately have got to be the advocate. You absolutely have to be the lawyer. You absolutely have to be the fighter and all the things, because it is your life. There is no person that comes in to save you. You have to do it. You have to save you. You have to take back your power and fight for your life. Because if you continuously see that others are not, healthcare providers are not going to fight for you, you have to fight for yourself. And you need to voice exactly what it is that you feel is wrong with you, and say, hey, I need for these things, just like I had to do with my lab orders. I need lab work done, and call these people every single day. It is tedious and it's tiring, and you're going to be frustrated. Do it, because this is your life. I wasted a lot of time. I lost a lot of organs, and I cannot get those things back because I let fear trap me. Don't make that mistake. This is your life.